Let's review anatomy for the DAO injection and answer all the questions about DAO, jawline, and the neck Botox that you left me on the previous video. There were several questions regarding the point for the DAO injection, and some of you were saying that this is the point that they were told to inject, and this is the point that I'm teaching in my video. So let's look at the anatomy. The DAO muscle goes from the corner of the lip and all the way down to the jawline. And this muscle is wider at its base and more narrow as it goes to the corner of the mouth. And also pay attention to this muscle right here. This is orbicularis oris. And this muscle in reality is much wider because, as you can see, it goes a little bit deeper. And this is, of course, the DOI. And this is the muscle that we're trying to avoid when we're injecting a DAO. Injecting in inferior portion right here is going to actually be the most safe and the least problematic area, because you're not going to hit the orbicularis oris muscle if you inject it more superiorly. And also in this portion here, even though there is a little bit of overlap, that overlap happens more medially. If you stay laterally and inferior, just like how I show in my video, you're never going to have any issues. And injecting it here will provide just as much relaxation and lift for the lip corner as if you were injecting it higher. So there's absolutely no risk for you to inject it here, and no reason why would you inject it higher up here. As far as the depth goes, as you guys can see, this muscle is more superficial. So when you inject here, you want to be past the skin, but kind of within first muscular layer. It feels really similar to when you inject the frontalis. Now, injections along the jawline here, it is something that goes very superficial because you only want to inject the platysma, which is much more superficial than the DAO muscle right here. Now, to answer your questions about the neck Botox, and yes, you can absolutely inject those central platysmal bands here. Just make sure you don't inject it deep, so you literally take the platysma muscle away from the deep neck muscle. Answering the question, why do you only inject it in the superior part and not lower, is because we had some issues with side effects of entire band injection of Botox, of patient feeling a little bit of pressure on the neck. It's like something is sitting on your neck. I've actually experienced it myself several times. It's not a big deal. Functionally doesn't affect your ability to breathe, eat, and do anything else, but it is kind of weird feeling, so we're trying to avoid that. And if you think of it, only superior portion of platysma really pulling down on that lower part of the face, so for the lifting effect, there's no need to go all the way down. Answering this question as far as injecting far laterally, yes, you can definitely inject it far laterally. No, it's not going to affect the masseter. No, it's not going to make your mouth go dry as long as you stay on platysma. So this is very superficial, and you just inject 2 units. Let me know if you have any other questions. I'm always happy to answer whatever questions that you guys have. Send me the DM, leave me in the comments, and I will cover whatever topics is that you have issues with.